Welcome to Your Health is Your Wealth. My name is Argo Duenas, and I'm your host for today. I'm also the owner of Back to Nature Health and Wellness Center, a local holistic center that has served the Baltimore, D.C., Virginia, Eastern Shore, Annapolis area for over 30 years. We offer a variety of services: colon hydrotherapy, detox programs, the ionic foot bath, energy work, and nutritional supplements. I am truly honored today to have as my special guest a phenomenal woman, a woman who defied the odds, a woman who turned a tragedy and a life-threatening illness into a powerful, powerful testimony and a passionate platform to help others. She is the CEO and founder of the Women's Collective, a human health service agency in Washington, D.C. She is a local, national, and global vocal activist for women's rights who have been suffering and living with AIDS, not only their families, but also their communities. So, Ms. Pat Knowles, thank you so much for taking time out of your busy schedule today to come down from Washington, D.C. to be my special guest today. I am truly humbled and I'm honored.
Thank you. I'm honored that you've asked me to, and more than happy to share the knowledge.
Absolutely. Well, you know, Pat, you have quite an impressive resume. You have done so much in the local communities, but you've also been on the national stage. And from what I have read here, you have been recognized for your heroism, your strength, your determination. You have received many, many prestigious awards, such as the 2010 Washingtonian of the Year, the NAACP Youth Council Award, the Gloria Steinem Award, Heroes in the Struggle 2005 awards, the Caribbean People's International Award. And you've also been featured in Essence Magazine, People's Magazine, Newsweek, The Washington Post, and on the national and local TV shows. And you also have been in the White House many times with presidents. So I'm humbled and truly honored. Now, Pat, before we talk about the Women's Collective and also its mission and the resources that you offer, I just want to give the viewers a little bit of information about Pat and where your ancestry and where you came from.
So I arrived into this country from Guyana, known as formerly British Guyana. I know that Jim Jones put us on the map.
Yes, I remember that.
Unfortunately, but that's where I'm from. I am of Indian descent, South Asian descent, and I came here to this country in 1973 at the age of 16 into Brooklyn, New York.
Okay. And you graduated from high school there?
Yes,
okay.
And graduated from high school in Brooklyn.
So now we're going to fast forward a little bit, and let's talk about the Women's Collective. When did you find the collective? What's the mission? And then tell us something about the resources.
Okay. So I founded the Women's Collective, unofficially since 1992. I started a support group and then got incorporated in 1995 and got our first grant in 1996.
Okay.
And was able to move it out of my home into an office. The mission is to serve women, girls, and their families impacted, infected or affected by HIV/AIDS, and now we've added Hep C and other STDs.
Okay. So where are you located in Washington?
So we're located in Southeast Washington, D.C. on Pennsylvania Avenue.
Okay, okay. So the mission is to empower and to provide resources for women
Resources and services.
And services for women, young girls, and their families living with AIDS and at risk, right?
Yes.
So tell us about some of the resources and the services, because that is so important. You know, we don't hear a lot in the news about AIDS anymore, but what I do hear on the radio, especially WHUR, is that it's still epidemic. Even though there has been a decline in DC, it's still epidemic. And then there's been a 20% decline in the overall population of the US, but 87% higher now in new cases with African American gay men and Latino men from the ages of, I think, 13 to 24. So can you speak about that after you tell us about the services that you provide for the women?
So we provide, we have two arms to the agency. We have the care side and we have the prevention arm.
Okay.
And on the care side, we have mental health therapies, we have case managers working with the ladies, getting them their medicines, doctors, food, housing. You know, they come in the door because of HIV, but unfortunately that's not always the most urgent need,
Right.
which is another show. We have, so we have that. We have people who will take them, we call them community health workers, who will take them to their doctor's appointment so that we make sure they're not just going one time, they're
Right.
staying in care. Because if you don't stay in care, you are going to die,
Right.
unfortunately.
Right.
We have support groups. We have skills building groups. So we have a lot of, we have groups with trauma. We have trauma groups around HIV, substance use, childhood trauma, adult trauma. We have licensed clinical folks who are providing services.
And so you've had your nonprofit, it's a nonprofit, right, since 1992, and have really impacted the community and really made a difference and really helped to have saved lives. And prevention, that's another leg of your, you want to talk about that?
Yeah, and so we have a prevention arm, and on the prevention arm, we have HIV, Hep C testers.
Right,
So we
right.
do that on site in the office, and also we have a mobile van that goes around in the community, DC, PG County, you know, a lot of the surrounding neighborhoods. And we screen, we test people, and then we get them into care.
And the testing involves what now? Not blood, but
a
saliva?
swab,
A
yes.
swab.
And you find out your results in 20 minutes.
Wow.
Yeah,
Wow.
I mean, you no longer have to wait forever, right? And
right.
so you find out. The
That's
thing that I
awesome.
like about the prevention side is that if you test negative, we don't just say bye, hopefully you change behavior.
Right.
We give them the tools, but we also have a prevention case managers.
Okay.
Case manager who's working with them to educate them, to teach them, and get them into care with this new drug that's available.
Okay, you want to speak about the new
Yeah,
drug?
there is now a pill that a prophylactic, pre-exposure prophylactic pill known as PrEP, the blue pill, that if you are on high risk, if you are doing high risk behaviors, if you have a partner who is HIV positive, any of these scenarios, you can get a pill to prevent you from becoming infected.
How long has this this pill been available?
It's been available for, I would say, about 4 years or so. The unfortunate thing is it started out that they were just giving it to gay men.
Okay.
And so women are now catching up and being educated,
Right.
and we're teaching them what this pill is and how they can use it.
And in terms of the demographics, are there more women infected now with AIDS than men?
No, I would say no, but it's not that far behind.
Okay.
It's still, the epidemic still is highest in Black MSM Latinos.
Latino, okay. Now, what is the mode of transmission now?
The mode of transmission is the same as it's always been, and people feel like they're safe if they're married. You're not. So heterosexual can get infected with HIV, gay men, women, anyone. There is no discrimination.
IV drug use.
IV drug use, any, sex work,
Right.
all of those things. Yeah, so no one is, immune to
So
it.
now we're going to go back in time, Pat, because this has been your story, and I believe that stories are the most powerful way to impact and make a difference in people's lives. The fact that you have defied the odds, and you're still here, and you're making a difference in the community, and you've turned this tragedy into just a powerful, passionate platform and testimony to help others. Now, let's go back in time. When were you diagnosed with AIDS, and in what circumstances?
Yeah. So I was married for almost 10 years. I had 3 kids. I had my 2 kids and my husband, and we moved here from Brooklyn to Maryland. Both worked for an organization that did lobbying on behalf of hungry and homeless people, globally and locally. So we were just moving along. And then I had my 3rd child, and she was born very sick, and no one could figure out what was wrong with her.
Wow.
And so, we just didn't know. And then by the time she was I went to the Mayo Clinic with her because she had heart problems. And I remember when I came back, my husband he wasn't well. And he had been to doctors for this cough he's been having for over a year, been misdiagnosed many times. And then in October, on the day of my daughter's birthday, he went to the ER and got admitted. And that month he was diagnosed with full-blown AIDS.
Wow.
And it all then began to make sense, what was going on with my 3rd baby, my sick baby.
Right.
So anyway, my husband died on January 1st in 1987, and my 3-year-old died June of the year, 6 months later.
Wow.
And I, at the age of 29,
Wow, 29.
yeah, I was diagnosed. I was sick. I was 80 pounds.
80?
80 pounds.
80 pounds.
I had no T cells. And
Wow. So your husband, how did he get the AIDS? He passed it to you?
so he was in the service.
Yes.
And he did do IV drug, but
Okay.
he had been clean for over 10 years. So they had told people back then, they
Right.
were saying, if it's been longer than 5 years, you didn't have to worry. So it's been long, so we
Right.
hadn't.
Right.
Of course, information, it was new in the epidemic.
Absolutely.
They were figuring things out. Now it's they're giving a different message.
Wow. So it showed up. He was infected and didn't know it. He was misdiagnosed. Is that correct? And off the air, I was sharing with you about my immediate supervisor at Walter Reed Hospital. When I worked at Walter Reed Hospital in the early 1980s, my supervisor, God bless and rest his soul now, he was just a wonderful soul. And he kept getting sick, and they kept misdiagnosing his condition. And finally, in the early 80s, he was diagnosed with full-blown AIDS, and he died. And they forced him out of the military. He was a major in the Army. They forced him out of the military. He was ostracized and stigmatized, and he just died a lonely soul. So what was your experience like back in the day in terms of your husband? And that was so sad to lose a 3-year-old daughter. How did that affect you?
Oh, it was horrible. It was horrible. The stigma surrounding this disease was horrible.
Yes.
And to be frank with you, it still is.
It still
It
is?
still is.
In
There are still,
2017?
you would think, right?
Wow.
There are still people who just don't want to be around folks with it. But back then it was pretty nasty.
It really was.
My husband, I had my husband in one hospital, my baby was in another, and I remember just running from making sure he's eaten at the hospital he was in, because they would leave the food outside the door. He would not eat and people were afraid to go in. And he didn't get the best care because of it. We were fortunate. Eventually, we found a couple of nurses who were kind. But I would do that, then I would run to the other hospital to make sure my daughter was getting
And
what
did she get
needed.
the same kind of care, treatment of the fears and the phobias
It
of
was
being?
still the fears and the phobia, but you realize that because it's a baby, people are
Right, more
nicer.
compassionate,
and-
right.
Yeah.
Yeah.
But it was just hard all the way around. And then, at that time to find out these two people, to find out about myself.
Yes.
And I'm thinking, and then so I got all my children tested, and my two oldest one, thank God, were fine and still is. But, I look at the family picture and it was 5 of us. And I
Wow.
say, 3 people in this picture,
Wow.
have been harmed. So, yeah.
How were you able to just deal with it mentally and emotionally? Did you get counseling? Did you have friends who were supportive, family members who were there for you? Because I can only imagine what you went through back in the early 80s based on my experience with my previous supervisor at Walter Reed Hospital. Because that must have been really tough.
It was tough. To be frank with you, I didn't tell my family right away. I lived in total isolation
Wow.
for a long time, afraid to tell anyone,
Right.
afraid of how my family were going to feel, and not how they were going to treat me. I know they wouldn't, but just the big picture of it was overwhelming. There was this stigma. I didn't know who was going to say and do what,
Right.
if people were going to stop coming to my house, if my children were not going to be played with anymore.
Right.
So I stayed isolated. I think I told my mom first, and she just sort of encouraged you, keep it to yourself. But eventually, I had to step out and get care.
Right.
After the death of both of them, then I had to breathe. I was getting sick, and so I had to seek medical care.
Right.
And that's when I quickly realized the services for women were really non-existent.
Really?
Yeah, like getting to the doctor. I didn't drive, so
Okay.
now I have a car sitting in the garage, but I can't drive.
Right.
So I had to get on public transportation. I went from 2 incomes to a
Wow.
disability check.
Yes.
I had to figure it all out. How am I going to survive? So someone says, okay, you need to go to this organization because they will help get you to the doctor. They have doctors, you'll get services. So I did. I went and I accessed a support group, but it was all men,
Wow.
and I was the only woman. So they were nice guys, but when you talk about, for me, my panic were about my 2 children.
Right.
I'm going to die. I was told I had less than 2 years.
Wow. Oh.
And I had to decide what's going to happen, like support groups, So when I begin to talk about those panics, they didn't understand.
Right.
So I kind of stopped going, yeah.
So that led you into really establishing at your home a support group for women. Is that right?
Yes. Yeah.
Tell me about that.
Yeah, I went to my doctors and I said, am I the only woman? Because I really believe I was the only woman.
Wow.
I had not seen women with HIV.
Right.
So she says, no, I have women, but unfortunately I can't share any of their information. So I put a secret phone in my home so that when my friends and family call, they'll be on a regular line. And I made a flyer and put in my doctor's office.
Wow.
All I wanted was to speak with some other women.
Right.
And put in the phone line, put a flyer in my doctor's office, and lo and behold, the phone started ringing. And we just talked to each other on the phone, none of us wanting to show our faces.
Wow.
So we were like this secret group talking. We had no idea who looked like what. And eventually, as we got more comfortable with each other, we were talking about side effects to the medicine, what we did to help
Right.
get rid of the side effects or how we dealt with them. Those were the kinds of things people were, women were concerned about. Who's going to take care of my kids? What am I going to do with my kids?
Right.
So it was all around those issues.
So tell me about the side effects, because you know, you mentioned the side effects, but the medications today, the protocol today is a lot better because the medications now have evolved. It doesn't have the severe side effects that you experience. What was the side effects from, you mentioned the drug again? What was the drug that
AZT.
Yeah.
the
What were
first
some of
drug.
the side effects of that?
So in the beginning, the first drug that was available was called AZT.
Okay.
And it was horrible.
Okay.
It was horrible. I mean, you were sick all the time. I mean, vomiting, diarrhea, weakness. It was horrible.
It was debilitating.
It was exactly. But you had to take it around the clock, every 4
Right.
hours around the clock. But it enabled us to be here to get another drug that would come out that's better, another one that's better than even that one. And that was the process until today. We have many drugs that people can take now for being infected. And they are, you don't have those horrible side effects any longer. So you can take one pill. We used to take about 25, 30 pills.
You were telling me.
Yeah,
Wow.
I mean, many pills. And today we have combination of 3, we have one pill, you have options based on what is your life like, how are you able, what are you able to take and things like that. So there's treatment and there is no longer, you know, if you are, it really is necessary to get tested so that you know and you can get on treatment early.
Right.
If you wait too late, that could be bad.
Right. Now, the difference from the drugs of yesteryear to the day is just significant. Is that correct?
Yes.
And you mentioned a cocktail of drugs, so it could be 1, 2, but the side effects are less.
Yeah.
And you're
very-
able to have some functionality to function in life, to have better quality of life. Is that correct?
Absolutely, absolutely.
Tell me, Pat, how has this experience really changed your life?
Oh, you know, I feel like this was what I was supposed to do, you know. I say that sometimes and then I feel kind of bad saying it because I had to leave, you know, I had to lose people.
Yes.
So, you know, I would have preferred to still have them with me.
Right.
But, you know, there's always this other plan.
Right. Absolutely.
That's in the works for us. And so I feel like I'm doing my life's work. I try to pass on the knowledge that I know, that I have, and I feel like I serve.
Yes.
I want to serve. And in the Women's Collective, we've saved lives. We've saved lots and lots and lots of lives all the years. We've gotten people in care who
Otherwise.
who were on their deathbed.
Wow.
Yeah,
Wow.
yeah.
Wow. So we all have a calling, and this obviously has been your passion. Tell us about your experiences at the White House, because I've seen you on Facebook many times at the White House with the Women's Collective, with Obama.
Yeah.
And so tell us, share with us
Yeah,
about
so
that.
I do a lot of advocacy. So we do the serving and the service and at the Women's Collective. But a very strong component to the Women's Collective is advocacy.
Right.
Because sitting at a lot of these tables are people, are mostly men, for one thing.
Okay.
But they also don't look like us.
Right.
There are no women at the table. There are no one that looks like us. So we have got to begin to infiltrate those tables
Right.
and sit there and get help to make decisions for our lives, because
Right.
many of these people are not infected with HIV,
Right.
have never talked to someone, but they're changing policy, right?
Right.
So
Right.
so I do a lot of that nationally, globally, like you said, but also I've gone to the White House several times,
Right.
helped to give input into what is known as the National AIDS Strategy, which the United States have not had, and then President Obama decided we're asking folks in other countries before we give them money to put a strategy together for how you're going to deal with this epidemic in your country.
Right.
But we don't have one.
Say
So-
that again for me.
Yeah, so to put together a strategy for your country
Okay.
that have AIDS.
Right.
So for folks from other countries who need help with HIV/AIDS,
We give money to
we
them.
give money to them, and we say, we need to see an HIV/AIDS strategy. What do you plan to do? How are you plan to do it? Who are your populations? Things like that.
Right.
But in our country, we don't have one. So we sort of, so President Obama decided we need to have a strategy. So I gave input into that strategy that is now known as the National AIDS Strategy. And what that does is it says what we need to do around HIV, it just lists everything.
Right.
And that trickles down into states. Everybody have to do the same thing. So I've been there several times, on different committees and
Right.
things, yeah.
Well, the feminine energy is rising. I truly believe that we are in a planetary paradigm shift now for women to bring balance and justice, and equanimity, and hear our voices and make policy changes. And you are one of the shift makers, paradigm shift makers. You're a phenomenal woman, Pat Knowles. Thank you for being my very special guest today. How can we reach you at the Women's Collective? Is there a website? What's your website address?
www.womenscollective.org.
Could you say that again?
Yeah. www.womenscollective.org.
And thank you again. And thank you for watching Your Health is Your Wealth. Remember, in this very present moment, we do have the power to take charge of our life and our health and make it a great day.